Hello and welcome to Hornbill TV's Health Talks, where we bring expert insights from healthcare professionals, top doctors and more into your health and well-being. Today we're talking about an issue that often goes unnoticed until it gets too late, our kidneys. These bean-shaped organs, they play a vital role in filtering out waste from our body and keeping us healthy. But diseases and cancers related to kidneys are often on the rise, especially in the parts of Northeast. So today, to break it down for us on this topic, I'm being joined by two top doctors from Medanta Hospital, Gurugram. Dr. Sanjay Gogoi, he is the chairman of Urology, Kidney Transplant and Uro-Oncology, and Dr. Manish Jain, he is the senior director of Nephrology and Kidney Transplant. So thank you so much, doctors, for your time and for joining Hornbill TV. So Dr. Sanjay Gogoi, he'll be focusing on kidney cancer and more on that, and Dr. Manish Jain, he'll be focusing on kidney diseases, transplants and more. So thank you so much, doctors. Before we go on with our topic, doctors, I wanted to ask you why you are here in Nagaland today. What is your purpose of visit, or how often do you visit a notice?
So we are part of an organization which routinely carries out this interaction with doctors across the country. We have repeated CMEs, that is with doctors and with the doctor bodies like IMA and state medical councils, and also we have round table conferences with practitioners across the country. This helps us to sort of share the learnings that we have had over the years with our peers, so that we can actually have a healthy, transmission of knowledge for betterment of our society.
Okay, very well. If you want to add, Doctor.
Actually, last year also I was here. So at that time I was in Dimapur and I was focusing on a talk how to prevent the kidney diseases. That was physicians with the Indian Medical Association from Dimapur. And this year, yesterday we went to Kohima. So with the Nagaland, that was a Nagaland Medical Council sponsored. So IMA Kohima, again we gave a CME. That's a continued medical education for the increasing the knowledge as well as prevention of the diseases. So that's why we are here.
Okay, very well. So Dr. Sanjay Gogoi, to begin with you, can you tell us what are the reasons for the high rate of cancer cases in the Northeast?
Yeah, it's a very important question. Northeast as a whole is considered as a healthy place with less population and probably less urbanization. But for some strange reason, the incidence of cancer as a whole is much higher than what we have for the rest of the country. Very rough statistics would show us that around in 100 cases of cancers over 1 lakh population is the density of cancer in the rest of the country. Whereas in the Northeast, and especially for Nagaland, the statistics goes as around 125 odd cases per 1 lakh population. This is actually significant, especially so because the population of a state like Nagaland is around maybe 2 million. So in that case, we have to worry, why is it so? Various factors have been sort of studied, including sort of the habit of betel nut chewing, cigarette smoking, as well as alcohol consumption. And to top it all, we also have the habit of having probably more amount of smoked food, smoked meat, red meat. These all have been thought to increase the incidence of various cancers, notably esophageal cancers, stomach cancers, and so on and so forth. And at the same time, this also leads to increased incidence of kidney cancers as well as prostate cancers.
All right. So, doctor, what is the incidence of various different kidney cancer cases in the northeast part of India?
Okay. So, luckily, the incidence of kidney cancer per se is not very high. So, roughly around 2 cases per 1 lakh population, which goes almost similar to what we have for the rest of the country, which goes to around say 4.5 cases per 1 lakh population. The only difference that can be sort of worrying is that most of these cancers are detected late. The early signs of kidney cancer detection, let's say, which could be like some traces of blood in the urine, are missed out. People pass it off as a routine happening, routine infection. So most of the cases of cancers, not only kidney, we have even prostate cancer as a number 2, present to us at a very late stage. And just to sort of drive home the point, almost 40% of prostate cancers which are detected in Northeast are in actually metastatic stages. That means they have spread and they are not curable. They can be only contained.
Okay. So now coming to you, Dr. Jain, could you tell us some of the most common cases of kidney diseases?
See, as we know, our population is growing and the diabetes incidence and hypertension incidence is increasing a lot. So, in generally, majority of the kidney cases are due to the diabetes and the hypertension. If these goes uncontrolled, they will have a proteinuria, that is a passing of the protein in the urine, and ultimately this will lead to the kidney disease. So 2/3 of the cases of kidney disease are due to the diabetes and the hypertension. That is, should increase sugar and increase blood pressure. Then autoimmune diseases, in which our immune system attacks the kidneys and the other organs. That also constitutes the kidney disease. In that, the commonest example is SLE, which causes lupus nephritis, and the IgA nephropathy. After this, the hereditary diseases are there, which are transmitted genetic, but their incidence is low, like a autosomal dominant polycystic kidney disease. The kidney cyst grows, and this is the cause of kidney disease. Then our urinary tract is there. The abnormalities of urinary tract can cause the kidney disease, like the stones which cause the obstruction, or the tumors which can cause the obstructive uropathy. And if we control them at a time, as Dr. Gogoi rightly pointed out, if we control them at an early stage, kidney disease can be prevented. Then certain drugs. We are in habit of having a painkillers. You have a full day body ache, you take the chronic painkillers. That will also cause the kidney disease. Transiently, the contrast agent which is used for CT scan, that can also cause the kidney disease. So we should be careful once you have diabetes and hypertension or any other thing, the prevention should be there. Then lifestyle. Smoking, which is very rampant now, common, that can also cause excessive alcohol. So these are the major causes which can cause the kidney diseases.
All right. So, doctor, we often hear that kidney cases can go undetected. So, how can we prevent these kidney diseases? What steps should we take?
Yeah, it's very simple. If you have blood pressure or diabetes, please take your medications regularly. See your physicians regularly. As we are a younger age, if we have a disease at an age of 40 or 50, that our strength is good, so we tend to not to take any medication. So that is the time which is causing the harm. So please take your diabetes and blood pressure medications regularly. Meet your physician regularly. Get your urine examination at the diseases, blood pressure, diabetes has been diagnosed. Don't take unnecessary painkillers. Have a good amount of water intake unless you have any cardiac problem or your physician doctor says that you don't take excess water. So these are some basic requisites that you take care of your general health. Don't smoke, limit your alcohol intake. That's the thing.
Okay.
Exercise regularly.
All right. So, Dr. Gogoi, you have mentioned about prostate cancer. So, what is your view on that? Could you elaborate more on that?
Oh yes, I would love to, because it is a common misunderstanding that if you grow older, older men I mean to say, you are bound to have a difficulty in passing urine, and that's part of living. We have seen our maybe grandparents or uncles suffer, so it's thought to be normal. Unfortunately, prostate cancer and non-cancerous prostate both present the same way. Okay. That is, by having some sort of difficulty in passing urine. So there are certain very easy tests to detect prostate cancer. So if anyone above the age of around 45 to the age of around 70, if you have difficulty in passing urine, don't neglect it. Go to your GP and he will do a set of tests, blood test and ultrasound test, which can detect the disease in early stage. One test, for instance, which is costing less than 500 rupees, can help you to diagnose the disease early, and that will prevent you from developing spread of the disease. And I mean, it's a curable cancer if it is detected in the early stage.
Okay.
Unfortunately, around, as I said, around 43% of prostate cancers detected or diagnosed in the Northeast are diagnosed when they have already spread to the bones, and it's not curable. So, and it goes across the society. I mean, it's not that only a villager comes late. Even recently, very recently, last week, I had a doctor who had advanced prostate cancer. So I think driving home a point would be that don't ignore your urinary symptoms. If you find that there are difficulties, do consult.
All right. So, doctor, you are focusing on kidney cancer cases. So, is kidney cancer something that runs in families? Is it hereditary, or what does or how big of a role does genetics play here?
Oh yes. So luckily in the South Asian our population, we don't have high incidence of hereditary kidney cancers. But if you go by the statistics again, of the total number of kidney cancers that are detected in our country, around say 4 to 6% are in the hereditary group. So how would you actually look into it is, if you have a younger man with a kidney cancer, let's say 45, 50, or even younger, we get now cases where as young as 25, 30 having huge kidney tumors. So these are the cases where we will encourage them to have the germline testing and those genetic testing, which can help us to detect the hereditary cell lines which predispose one to have kidney cancers. And especially so because of the mixing of population. Now Indians are not located within India, we travel around the world, we marry people from other countries. So many of the genetic diseases which were not typical to our country are actually now coming in.
Okay.
So we need to be aware about it, that many of these cancers can be hereditary, and when doctors are having the added responsibility to investigate for that.
Okay. So Dr. Jain, now coming to you again, once someone is diagnosed with kidney diseases, like what are the treatment options that we have?
See, when the kidney disease is diagnosed, basically any diabetes or the hypertension patient, they should get the renal function test, that's the kidney function test. Simple blood urea, serum creatine, which is simple blood test. Whenever you are giving a urine, a blood sample, get the test result. Check the urine for the proteinuria. So when these are there, then the blood pressure and sugar medications, as I have already commented, has to be taken regularly. If your sugars are uncontrolled, don't hesitate to take the insulin if it is prescribed by a doctor. Certain times we have a myth that once we take the insulin, we are going to land in a problem. No, if your insulin, you take it regularly, you can prevent the cardiac disease, you can prevent the brain disease, you can prevent the kidney disease. Don't take painkillers. Keep your blood pressure, take medications regularly. So once your physician is there, they will give a certain set of medication for proteinuria, that is the ACE inhibitors or the ARBs, which will be given by the physician. So take your medicines regularly. Keep general things, the illnesses which are there under control.
Alright. So doctor, in cases where kidney failure happens, like what are the options available? Dialysis or surgery, or how is it?
When the kidney failure is there, that is the chronic kidney disease stage 5. So there are two types of treatment, dialysis and the transplant. Dialysis is further divided into two types. It's a home dialysis, which is a peritoneal dialysis, and the hemodialysis. For hemodialysis, you need to go to the hospital around 3 times a week. Each dialysis is for 4 hours duration, and for that dialysis, you need a catheter. Either they will put a neckline or they will make a fistula. They will join the artery and the vein in the hand, and through that dialysis can be done. For this, you need to go to the 3 times a week in the hospital. 4 hours duration is there. Regular dialysis should be done. The home dialysis is a peritoneal dialysis. In this, we put a catheter. The Dr. Gogoi, urologist, will put a catheter into your belly, and your peritoneal membrane, God has given us a peritoneal which acts as a dialyzer. It's a semi-permeable membrane. So 2 liters of fluid is inserted into your belly, and that is drained after 4 hours. So that has to be done. This is known as CAPD, continuous ambulatory peritoneal dialysis, 3 times in a day. And certain times we switch over to the cycler. That's a machine which can perform this dialysis at a night. Night you attach to the machine, morning you can detach it. So this is a home dialysis which can be easily done. The only risk is certain types of peritonitis can be there, that's an infection of the abdomen. But be careful, maintain your hygiene. After COVID, it has taught us like how to maintain the hygiene, wear the mask, hand washing, that's important. Now the best treatment is the kidney transplant. So you need to have family donor, 18 to 70 years of age, who is not a diabetic, who has a blood pressure under control, not a major cardiac disease, they can donate the kidneys. So let's say that it's a compatible donor, same blood group is there, O is a universal donor, AB is a universal recipient. So this is the kidney donor. If your family donor blood group doesn't match, we can do a AB incompatible transplant also, where the donor from the other blood group can donate to the other group, but certain tests has to be done. So kidney transplant is the best modality of this treatment.
Yes, from a common man's perspective, I've also heard that some patients after going transplant they are living only with one kidney and they are living a completely normal life. So what extra care do they need to incorporate in their daily life? Could you, if you can also.
This is a very good question. This is a very intelligent question. See, after kidney transplant, as soon as you implant the family member's kidney, whether it's a mother's kidney, father's kidney, our body doesn't recognize that this is my kidney. So our immune system gets activated and it will try to reject this kidney. So for this, you need to take the immunosuppression medications. As the name implies, it suppresses your immune system. So why we have to suppress the immune system? So that body can accept the kidney. So this immunosuppression medication has to be taken regularly, though with time this decreases, but you can't completely stop it. The negative point of immunosuppression is that if your immune system is low, chances of getting infections are high. So you have to maintain your hygiene, you have to take your medicines regularly, you have to take a good amount of water until unless your doctor says you don't have to take because of the cardiac problem or something. So you have to live a simple life, and regular medication is important. So there is a very thin, delicate balance between the medications as well as the kidneys. So we have to prevent the infection also, as well as at the same time we have to see that there is no infection also.
Okay.
But they can lead a normal life.
Okay, so Dr. Gogoi, now coming to you again. How can one diagnose kidney cancer, and what are the early symptoms that we have to watch out for?
Yeah. Well, kidney cancers, they are mostly silent in the initial stage, and we need to have a very high index of suspicion. A very good habit of annual health checks, which includes urinary testing, can detect presence of red cells in urine. A routine ultrasound scan of the whole abdomen can pick up these diseases. Ultrasound is very sensitive in picking up tumors as small as 1 centimeter to 2 centimeters in the kidney. Now, kidney tumors which become symptomatic, like when they actually start causing a swelling that can be palpated, or when a person start having pain, or lastly even someone who start having frank blood in urine. These are deemed as advanced cases, and of course those can also be surgically treated in most cases, but the ones which can be very well treated without any lasting sequelae or complications are the early diagnosed kidney cancers. My advice would be that once a year, maybe a whole abdominal ultrasound or blood test, these are and urinary tests, these are going to be diagnostic.
Okay. So now, doctor, the treatment plan has changed a lot over the years. So what are the new advancement or medical advanced technologies or the new medical advancements that you want to share that will help in preventing kidney cancer cases and etc.?
Okay, so a lot of advances have happened. So not all kidney tumors needs to be removed. The kidney does not have to be removed in all cases. So previously it was thought that if you have a kidney cancer, it's a very dangerous cancer, we have to go for surgical removal of the organ. Since the last 2 decades, different groups around the world have started practicing something called partial nephrectomy, whereby we only remove the tumor and save the kidney. Now that particular surgery used to be a big and very, very complex surgery, open surgery, many hours long. Now that has been now sort of improved upon by laparoscopy and most importantly by robotics. So now if I have a person who is going through a similar surgery, partial nephrectomy we call it, robotic partial nephrectomy, it's now a very, very sort of structured treatment. Patient gets admitted, gets operated, and on the 5th day he is discharged. So it's not something what I witnessed as a medical student, where it was much more different. So now people who undergo this sort of robotic kidney surgeries to save the kidney, they can actually live a normal life as he was living before, without having to worry about going into kidney failure. More importantly, sometimes what happens is this sort of tumors are diagnosed in people with only one functioning kidney. So in such a case, if you have a tumor in that kidney and if the kidney is removed, so he will require immediate dialysis, and he will have to be on dialysis for several years before he is deemed cured of this cancer and he gets fit for transplant. But with now these technologies, we can actually treat him and save him from going into the CKD status. And technologically, another few more things have happened in the field of diagnosis. We have better radiological imaging techniques, whereby we can use to detect the metastatic disease or the spread of the disease with advanced PET CT scans at much earlier stage before they become complicated.
Okay, so Dr. Jain, last question for you. After the transplant process is done, can a person live a normal life, and then can they have a normal sex life as well? And even for women, can they have children, or are there risks, or what are the kinds of risks that involves after doing a transplant? The pros and cons.
See, this is the biggest advantage of the transplant. After transplant, they can lead a normal life. Definitely, transplant patients are at risk of rejection, and rejections do happen. That can be acute rejection or a chronic rejection. So that's why you take your immunosuppression medications regularly. With time, medications reduces. So, but the timings are very important. That timings, because the drug level has to be maintained in the body. So take your blood pressure as well as your sugar medications. Take your regularly. And what is regarding the sexual life, they can have a normal sexual life, but with certain cautions. Yeah, for male it's not a problem, but for female generally we say it's a 1 year, but we say 2 years of after transplant. If their kidney function are normal, they don't have a proteinuria, then we suggest them that they can go for a baby, conceive the baby. But we need to change the medication, because these medications can be teratogenic, like certain medications are released and then we need to change the medication before they conceive, so that it can be safer. The only thing, they can have a premature baby, they can have a IUD, some baby sizes can be small, so we have to be cautious, and in that way we should be important. There are certain diseases which can recur after transplant also, the recurrence is there, so that we have to be cautious. So definitely their life changes. My 3 of patients, like female patients, they conceive the baby and they are having a very good life also now. But they have to routinely follow us. They have to take the medications regularly. And before conceiving, because they have to tell us, in our pros and cons also, we tell them this also. Whenever you are planning to conceive, you have to please ask us, so that we can change the medications accordingly, which are pregnancy safe. As you know that painkillers cannot be taken in normal pregnancy. So these medications also will change it when they are planned.
Okay, all right. So Dr. Gogoi, last question for you as well. Is there any connection between dialysis and kidney cancer?
Yes, some people actually speak about those things, that if I have dialysis for long, I'll end up having kidney cancer. Actually, it's a myth. Dialysis is a form of renal replacement therapy, and till the person is having the access to kidney donor, he can go safely on a dialysis program. What actually happens is, when you have chronic kidney disease, many of patients develop something called acquired renal cystic disease. They have like cyst in the kidney, which is not caused by dialysis. This is part of the disease process of the chronic kidney disease. And some of this acquired renal cystic disease can be malignant cystic disease. So I think some local newspapers or maybe some articles they would have read that if I go on dialysis, I'll end up having kidney cancer. That's a myth. It's not true.
I would like to add one thing. See, dialysis is the treatment which is the requirement of the patient. If they don't go for the dialysis, their survival won't be possible. So at that time, we don't have a choice. So dialysis, if it's required, they have to
do it.
Otherwise, they're not going to survive. Generally, we do a dialysis, so we tell them for a three times a week dialysis. So during dialysis, our doctor sees them and we ask them to encourage them to see us in OPD also after a month. So we do certain tests after every month. Other tests like serology after 3 months also.
Okay. All right. So if there's any last message that you would want to convey to the viewers?
So between both of us, because he's a nephrologist, I'm a surgeon, urologist. People, they talk about the heart, the lung, the liver. The kidneys are always sort of neglected. These are silent organs. They are very, very, mysterious organs. They convert blood into urine. They filter our blood of impurities and keeps us healthy and alive. Do take care of your kidneys. Doesn't take much effort. Do not let your urine become dark. Be cognizant of the color of urine when you pass out. Drink sufficient liquid. have good food, fruits, less of salt, and maintain your daily activities, healthy activities, and they usually will not let you down. You will always have a healthy life. As Dr. Manish said, don't take unnecessary painkillers, don't have unnecessary injections, don't go to the chemist and take antibiotics for common sore throat or infections. Those are the ones which actually poison the kidney.
Dr. Gogoi has rightly said that chronic kidney disease is coming out of it. It's like it will be a fifth most common cause of death worldwide. And in India, it is going to be a diabetic capital. So a basic thing, again, as I'm again and again telling that this is a very good education for everyone. Please take your blood pressure, sugar medications regularly. See your general doctor, whoever is seeing you. Follow his advice. They are giving the advice to prevent your illness so that it doesn't lead to the complication, whether it's a micro or the macrovascular complication. Don't take unnecessary painkillers. You are tired at the end of the day. The simple thing is we'll go to the chemist shop, we'll take a Brufen, Nimucilide or something. That will improve your pain, but it's causing the harm. For the one who are going to the gym, supplements, don't take extra unnecessary protein. Maintain your hydration. See, once you are going to the gyms, the boys or girls, whatever, they will take a gym supplements, lot of huge proteins will be there, and they won't take the water. Instead of that, again they are taking the protein shake. So that adequate hydration, proper water intake is must. So these are the basic things. Eat healthy, live healthy, do not smoke, limit your alcohol intake, go for a regular walk or exercise. If you are diabetic or hypertension, again start gradually. Start going for a walk regularly, exercise regularly. Start it in a milder form and then gradually increase it, but under your physician guidance. So basic things, just eat healthy, live healthy.
All right. Thank you so much, doctors,
Thank
for
you.
your insight on this topic, and thank you so much for your
Thank
time.
you.
So
Thank you.
yes, if you're watching this and feel concerned about your kidney health, don't ignore the signs like our doctors have already mentioned. Regular checkups and early intervention can make all the difference. So that is all for today's health talks. For more information and for more health talks like this, keep watching Hornbill TV.